Hello, my project is on obesity and its impact on the borderland and just in general. Obesity is defined as a BMI of greater than 30%. Number of El Pasoans are considered overweight, about 35.6% are. In Texas, it's about 35, and nationally, just under 31. This was taken all around the same time period. Obesity is characterized by intake higher than the energy expelled when you eat more than what you're putting out energy wise, so exercise in other words. Obesity can cause a lot of secondary diseases, mainly hypertension, coronary artery disease or heart disease, and diabetes type 2. In some extreme cases, surgical intervention can be required. For example, cholelithiasis or cystitis is pretty common with people that are obese. I see it pretty often working in surgery. Basically, we have at least one surgery a day. Many of the secondary diseases a person would normally expect to have at an older age are being seen in younger and younger populations, like diabetes. Prevention, obviously eating less calories or having a more balanced diet, plenty of water and electrolytes, lowering the amount of sugar and fatty intake that you may see. Recommended exercise would be 40 minutes of moderate exercise 3 to 5 times a week, where your heart rate's over 100 beats per minute. This could be anything: walking, swimming, aerobics, bicycling, whatever the person prefers. And then maintaining the weight loss is very important also. So avoiding fatty diets, keto, any other kind of diets like that, or may cause yo-yoing, where a person gains weight. It's been shown that this can cause other secondary symptoms like diabetes or hypertension to happen more rapidly in a person. Obesity has nearly tripled in the last 50 years. In 2016, more than 1.9 billion adults aged 18 and older were overweight. A lot of the health issues, like I said, diabetes type 2, this is caused by a inability of the person to process insulin properly, or the body to produce and or use the insulin. I guess insulin resistance would it specifically be called. Type 1 would be when they're unable to produce insulin at all and would require insulin injections. Heart disease is very common also with people that are obese. Other factors that lead to obesity are genetic components. So if your parents or grandparents are obese, you are more likely to be obese yourself. And of course, that can be transferred onto your children also. Other factors include socioeconomic factors. Here in the United States, lower income families tend to be more obese compared to wealthier families. And it scales with income also. But we are seeing a shift in culture overall. People are becoming more health conscious and are paying attention to what they're eating a little bit more than they did maybe 10, even 20 years ago. The environment can also affect it. People living in lower income areas may not have easy access to public spaces like parks or walkable areas. Like if their sidewalks are damaged or there's just not sidewalks at all, or it's just roads, they may not be inclined to walk. Essential things like grocery stores also. If they don't have easy access to grocery stores, or for example, a McDonald's is around the corner. It's easier to get McDonald's by walking over there or driving than it is to drive 30 minutes to a Walmart or a grocery store that sells fresh produce. For a person to start losing weight or becoming healthier, early education is important. Starting in schools, a lot of public schools are already doing this with healthy eating type classes, health education, physical ed. This has been going on for a couple of years. More available resources for the kids outside of the class. Helping kids stay physically active. Obviously, they do physical exercise, PE classes typically, or recess to help them burn more calories. This can help socially motivate them as they become adults to continue physical exercise. And also the children becoming more active sometimes prompts the adults also, the adults and their family, parents, grandparents, to become more active too. Another factor would be the diets. Specifically here in El Paso, Hispanic populations are about 1.2 times more likely to be overweight compared to non-Hispanics. Hispanic children are 1.8 times more likely to be overweight. And about 40% of Hispanic males and 43% of Hispanic women are overweight comparatively to other races and ethnicities. Many of the traditional Hispanic diets include, well, I guess modernized Hispanic diets are, there's a lot of fried food, unhealthy types of foods, tortillas, for example, and this is also based on regions. So coastal regions will have higher fish diets opposed to where we are, where we're in the middle of not a landlocked state, but we're far from the coast, so fresh fish isn't as common, or I guess fish in diets isn't as common here as, let's say, somewhere near Corpus Christi. Hispanic diets that we consider now came from native Central and South American cuisine. These were actually pretty healthy and can be compared to Mediterranean diet, which is considered a very healthy diet. The traditional Hispanic diet was high in vegetables, grains, healthy fats, like HDL. Traditional vegetables included peppers, squash, yams, yucca plants, that type of stuff. Corn, brown rice, seeds, maize or corn. Proteins were usually beans, some type of bean, fatty fish, chicken, quail, and red meats like beef and pork were easily available. Fruits include like papaya, bananas, yams, yucca, and pineapple also. Fats that they would consume were usually olive, avocado, or sunflower oil, which are all considered relatively healthy or healthy, that also have high HDL levels. So what we see now is a lot of families that are immigrating from Central and South America are actually kind of full-lipped diet-wise, because I guess there's a cultural, I guess how do you say it? Because they come from very poor areas, they tend to be the opposite of Americans, where they're of an ideal weight the lower income they are, and as their income increases, they tend to become overweight. And I guess that's more of a perception in their heads, first, second generation, that as they become more wealthy, they tend to splurge a little bit more on food, that type of, or in excess. Let's see. the high correlation of being overweight or obese with coronary artery disease or type 2 diabetes, high cholesterol, these sorts of things are all secondary diseases, like I stated before. A lot of these diseases may or may not manifest. So one person may have diabetes but not have hypertension, or will have some type of kidney issues and a little bit of hypertension but not diabetes. So it's kind of a toss up a little bit of what they may have or may not have. But as they get older, it's more likely that they'll have multiple, or more likely to have multiple of these diseases. Another issue is a lot of people tend not to get seen until something catastrophic happens. So they may not ever go to the doctor because they don't feel well because of their blood pressure, or they may not even notice the symptoms or know what the symptoms are until they have a heart attack or a myocardial infarction and end up in the hospital. And then they find out then that they have high blood pressure and diabetes and all these other diseases. It's important to educate patients wherever we can. Other issues may be maybe they go into the doctor because they're not feeling well, or they've been to the doctor a couple of times and they find out that they have hypertension. Like we've all heard stories about people going into the doctor because they have COVID and they find out that they have diabetes or hypertension that they didn't know they had before. People may be in denial about this. They'll think, oh, I'm just fine, I feel fine, this and that, and they never take their medications, or they just continue living the lifestyle that they had before. Unfortunately, sometimes the catastrophic event, heart attack, or what have you, stroke, may prompt them to finally change their lifestyle. Of course, these are extreme examples. Hypertension is categorized as a systolic blood pressure over 140 and a systolic or diastolic blood pressure over 90 millimeters mercury. This affects about 74 million Americans, and only about 77% of them are aware of their condition. Out of that 77, 68 are actively treating it or proactive about it, and about 55% of them are under control. So that's a tiny amount. Off of 74 million, maybe about 15 million have it under control or actively treating it. So that's a tiny number in comparison. As far as type 2 diabetes, to be considered diabetic, a fasting blood sugar of 70 to 110 deciliters. If it's over that, then they're considered diabetic, or an A1C over 6.4. High cholesterol, cholesterol over 200 milligrams a deciliter, LDL less than 100 milligrams a deciliter, HDL greater than or equal to 60 milligrams per deciliter, but that's kind of the one we want to be high. Triglycerides less than 150 milligrams a deciliter. High cholesterol can lead to hypertension. That's usually why obesity leads to high cholesterol. High cholesterol leads to hypertension. Another issue that obesity, or people that are obese or overweight, may come across is sleep apnea or obstructive airway disease. It's a condition where the tongue becomes relaxed and covers the airway, and it temporarily obstructs the whole airway, and they don't breathe for a few moments while they're asleep. And there is a strong correlation between sleep apnea and obesity, and in rare cases it can cause death. Like smoking and drinking, obesity is very preventable from the earliest ages until pretty much the grave, just about. Um, it can be difficult without proper support, if not impossible. Resources can be found pretty much everywhere. It's just a matter of people wanting to look or deciding to. Primary healthcare providers, internet groups, or even family members that work in the healthcare field can assist. Like I said before, the most effective way to prevent obesity is to prevent it before it happens. Education on eating habits, adequate physical activity, social support, trying to keep your weight below the 25% BMI. When addressing obesity in children, it can be a sensitive topic for some families. It can easily be taken into offense if approached by a school nurse or even in the doctor's office. Parents can feel as if because their child was obese and we're telling them that they need to lose weight, that they maybe don't love their children as much. So a lot of, especially in the Hispanic community, and other communities too, feeding your children or overfeeding is kind of common because you love them and you want them to have more and as much as you can provide. But this is kind of to their detriment. If a family decides to lose weight, it is important for them to try to do it together. So if the whole family is trying to lose weight, all of them getting together and deciding on meals, deciding on activities to do together, even separate if they want to do it separately or in different groups. If the dad and a daughter likes to ride their bikes, but the mom doesn't, then the dad and daughter go ride bikes. And then the mom and the son can go for a hike, for example, or whatever they prefer. Or if they all want to go swimming, they'll go swimming. This will more likely provide a familial support and the fact that they're all together and, social support, family support. What's the word? They're more likely to succeed all together. Most people fail in weight loss because of a number of factors, like I've gone over before. The most common is because of dramatic change in lifestyle. People tend to just kind of jump into a weight loss regimen or a diet instead of easing into it. Instead of doing one thing at a time, they may cut out all fast food, cold turkey, and then start exercising like crazy. They'll end up failing within a month. How many New Year's resolutions do we hear about? People are going to start exercising. The gym's busy for a month and then it goes back to normal because people jump into it too quickly. It's better to maybe eat a salad every day opposed to getting fast food at lunch. Eat a salad at lunch instead, then work off of that. Start riding a bike for 15 minutes, 20 minutes a day. Easing into it is shown to provide better results than jumping straight into a diet and exercise. And it's also important to consult a doctor or a healthcare provider if they think that they need the support or they're not too sure where to start. And then the quality that the healthcare providers provide the patients will also factor into how well they do. Providing a safe, if a patient is already diabetic, has hypertension, and other secondary diseases, it's very important for them to go see their healthcare provider before they start any sort of diet or exercise regimen, so they can help guide them. And it's important toward their safety because, like I said, they don't want to jump into doing a 1 mile run when they haven't ran in 20 years and their hypertension, they have high blood pressure over 200 regularly. and of course the education the providers are going to give, and any kind of resources that they have, any other dietitians, or maybe they even have resources for personal trainers that can help guide them with exercise. I think that's about it. And thank you for listening to my video, my presentation. Have a good day.